excited people ever. They can't wait to start their journey. Over time, though, the nature of that work can drain the emotional bank account, not only for nurses, but for all healthcare workers. It's up to leaders to make regular deposits to counteract the withdrawals. That's what Why Cope When You Can Heal helps us accomplish, and I think it serves many other purposes as well. This book is a great reminder about the critical importance of self-care. As a profession, we focus on caring for others. We are truly passionate about that. But too often, doctors, nurses, and other frontline workers don't take the time to care for themselves. When we don't practice self-care, we're focusing only on one prong of a two-pronged job. We've all heard the analogy about putting on our oxygen mask first. Healthcare professionals have the responsibility to stay mentally and emotionally well, so they'll have the inner resources to help patients heal. It's up to leaders to teach employees to practice and prioritize that self-care. Left to their own devices, many employees will not do so. As Mark and Diana point out in Why Cope When You Can Heal, healthcare workers tend to ignore their emotional wounds and soldier on. At times, this may be a result of what the authors call healthcare's just get over it culture. But I also believe people keep on keeping on simply because they care so much. That's how mission-driven these people are. Part of the leader's role is to gently intervene where needed. The book also shines a light on the importance of leader training. A huge part of the leader's role is giving people the tools they need to do the job. I'm not talking about personal protective equipment or PPE here. I'm talking about leaders knowing how to help employees prevent and heal from post-traumatic stress disorder, PTSD. This kind of training may not have seemed so urgent in the past, but COVID-19 has brought it to the forefront. Training needs evolve with changing circumstances. Here's another reason that leaders need specialized training in the COVID-19 and hopefully very soon the post-COVID era. Mark and Diana talk about the stigma around PTSD and other mental illnesses. Since leadership sets the tone for the hospital, it's important to ensure leaders get some training around this issue as well. When leaders are purposeful about breaking down the PTSD stigma, others will follow their lead. Why Cope When You Can Heal reminds us that we need a refocus on leadership fundamentals. Over the years, we've found some tactics that work well for keeping employees engaged and connected to the larger sense of purpose that keeps them going. Good performance management practices, leader rounding on employees, thank you notes, and other forms of reward and recognition, and so forth. Yet, even organizations that do an effective job of hardwiring such tactics can drift away from them. In times of crisis, we must bring ourselves back to these fundamentals. We need their good results and the structure they provide more than ever. Take rounding, for instance. In terms of engagement tactics, this one is a powerhouse. Essentially, leaders put a system in place to make sure they regularly meet with each direct report. The idea is to ask a series of questions aimed at getting to know people and making sure they have what they need to do their best work. In the best of times, rounding is a tool for creating a great employee experience. In the worst of times, it's a lifeline for making a deep human connection, reducing uncertainty and anxiety, and ensuring that employees are truly okay. In Chapter 7, Diana writes about communication. She notes that even if we think we're communicating well, in times of crisis, we almost certainly need to do even more. I've seen the truth of this over the years. When people hear nothing, they assume the worst. The more you check in, the less anxious they'll be. Rounding is a good tool for keeping people informed, but also be sure to share information in other ways. Employee forums, hospital message boards.